Welcome back to Open Line tonight. We are talking about the coronavirus. We're asking for your questions. This is a great night to get those answers. I have Dr. David Aronoff here with me from Vanderbilt University Medical Center. He is the director of the Division of Infectious Diseases. You have seen him all over our coverage the last couple of weeks. He's the top guy you want to answer these questions. So, Dr. Aronoff, thank you again for being with us tonight. I'm going to get right back to these calls because we are starting to get a lot of them. Renee, you've been hanging on there for a while now. Renee, go ahead with your question.
Okay, my question is regarding the use of these masks. I do work in the healthcare at an assisted living, and I have family members that work at doctor's offices. And all these homemade masks are going around, and some they put the filters in, some they don't. I'm very fortunate because I do have a couple of the N95 masks from years of home health where I was an RN in home health. But in regards to the mask, if you're working at a doctor's office and you're using one of these homemade masks, just say you're a receptionist up front and you're the one that signs these people in, I mean, really, what is the safety if they have a patient that does have the coronavirus 19 and they're signing in at your window and you have one of the homemade masks? I mean, what kind of protection does that really provide?
It's a great question because we are getting, different information on this. The CDC is now recommending that we all wear them when we're out in public. Doctor, what's your perspective on this?
Yeah, what a great question, because this is sort of a changing area in terms of messaging as well. So certainly for healthcare providers who are working face-to-face with symptomatic patients who have a new cough or shortness of breath and fever and are suspected of having coronavirus, then proper hospital-based personal protective equipment, what we call surgical masks or droplet protecting masks, are important and likely to protect the healthcare worker against getting infected. In certain areas, operating rooms of some type and certain medical procedures that lead to what we call aerosolization events, then really restrictive masks like the one the caller talked about, the N95 masks, are useful in those settings. And within the healthcare setting, hospitals are aliquoting these masks based on risk. Now, the issue with the cloth masks is an evolving one. So first and foremost, it's important for viewers to know that the two most important ways that we can prevent transmission of this virus from person to person are distance between people and hand hygiene in case somebody accidentally gets it on their hand from either touching a common surface, or some other artificial surface and then touches their face. But primarily it's distance. And this issue of keeping more than 6 feet away from people is really, I think, the most important way to prevent spread. The issue with the cloth masks, well, some proportion of people who get infected with this coronavirus don't know that they are infected. They are either in that window between when they get infected and when they develop symptoms. We call that window the pre-symptomatic window. Or they're not going to get symptoms at all, and they have what we call asymptomatic infection. So it's possible that there are people walking around in public who are shedding virus when they cough, or when they speak, or when they sneeze or breathe, and they don't know that they're infected. And for those individuals, wearing even a cloth mask is probably protective to the people around them, because it prevents the spread, what we call the dispersal of these droplets of water with virus out into the air around them. And so one primary reason for asking people in the public to wear cloth masks when they're going to be in crowded areas like grocery stores with others is that it's really protecting the people around you as if you, with the mask, might be shedding virus. The second thing is that if somebody is not infected and they wear a cloth mask, they might be protected from getting infected from the virus if someone is next to them and doesn't have a mask on and is shedding virus. It may provide some protection. So the example you gave as the caller is a receptionist at a medical clinic, and somebody comes in to check in, and the receptionist is wearing a cloth mask. Assuming that the person checking in is not coughing or sneezing and is able to keep some distance between the window and the receptionist, which I think these days is a good thing for clinics to make sure that they have a little bit of extra distance there, that might provide a little bit of protection. I think more important is to be doing some screening of the people coming into clinic, and if they have symptoms of a cough or a sneeze, they should put a mask on if they're in the clinic to protect not only the receptionist, but other patients and other healthcare providers. And then the final reason why cloth masks may confer some protection out in public is that they're a really good reminder to everybody around that, oh yeah, there's a pandemic going on and we're supposed to be staying apart from each other. When we see somebody wearing a mask, it's kind of a good reminder that, oh yeah, I need to do hand hygiene. I need to stay away from somebody. So those are some of the reasons why we're recommending the cloth masks. We don't really know exactly how effective they are at preventing transmission, but we do think that they help a little bit in the ways that I just explained.
We have a Facebook viewer who asked a question about immunity, and after somebody recovers, are they automatically immune to getting this again?
Well, everybody's asking the key questions, and we're really interested in knowing the answer to that. We think the answer is yes, that people who recover do have protective immunity. The question will be, how long does that immunity last? And is it protective against just the particular coronavirus strain that they got infected with, or would it even provide some cross protection if a related coronavirus ever comes out of an animal population and into humans again? So there's a lot that we're going to be trying to learn coming out of this pandemic, and one of them is how protective is antibody-based immunity. That's also important for our vaccine efforts. You know, a number of vaccine candidates are starting to be used in human trials to prevent infection. And I think between the vaccine candidates and the natural infection, we're going to learn a lot about how protected we are from future infections. So stay tuned is what I'd say about that.
When you mention that vaccine, I think of the flu vaccine, which has to change every year, and it's always predicted what strain will have the flu, and then it's only slightly effective. You know, the numbers vary, whether, you know, people, you know, kind of hit that target guessing which flu strain it would be every year. So are we going to be looking at a vaccine that has to change constantly to keep up with a revolving coronavirus? Are we going to be dealing with this sort of thing year after year?
Well, gosh, I certainly hope not is the short answer. The flu is a tricky virus. It's been with humans for many, many years, and we know that it genetically changes a little bit year over year, and there's different strains that circulate. It's always a pest for humans, and we try our best to develop vaccines to protect our vulnerable patients who actually can have really severe infections from the flu. This coronavirus is, to our knowledge, the first time it's ever been in humans, and we hope it's the last time and that it goes away. But you know, we don't know if this is going to establish in human populations as a seasonal infection that tries to come back around, and we would hope, if that's the case, that one vaccine or a previous infection will be absolutely protective and we will not need to give a new vaccine every year. But we really don't know. And I think we do have to be prepared for the fact that at some point in our future, we could have another pandemic just like this one, caused by a cousin coronavirus. And if that's the case, we will hopefully learn a lot about how to very rapidly develop a new vaccine. So really good questions. I wish we had firm answers, but my hope is that this is not something that requires a new vaccine every year. I really hope not.
Yeah, I hope not too. Let's go to Nancy. Let's try to sneak in another question before we have to take commercial break. Nancy, you have the floor. Go ahead.
Okay, thank you.
You're welcome.
Okay, my question is about the mask and the gloves. Okay, I wore both. I wore the mask, not the homemade mask, the other mask, and the gloves when I went grocery shopping. Now, when I get home, do I throw those away?
you only use them once?
Great question. Doctor, what do you say?
Really good question. First of all, I don't think that we need to be using gloves when we go grocery shopping. The way that this virus would get from our hands to cause infection of us would require us to touch our face with virus on our hands. If we get virus on our hands, the skin of our hands, it will not cause us to be sick. It can't get into us through our skin. So if we wash our hands as soon as we're done unpacking groceries, or as soon as we get into our car or vehicle after shopping, we're able to use hand sanitizer, then we're good to go. And good soapy water for 20 seconds takes all of that off of our hands. Gloves, require a lot of manipulation. If you get virus on your gloves and then you take your gloves off, you still have to wash your hands. So I don't know that there's any added benefit to putting gloves on when you go to the grocery store. It may create some sense of confidence, but I don't know that it's actually needed, and we're not recommending that. In terms of masks, I think it really depends a little bit on the material that the mask is made out of. There are some ways so certainly cloth masks can be washed in, for example, if you have access to a laundry machine, then you can wash on hot water with laundry detergent, and that will sanitize the mask just fine. If you don't, a good hand wash in soapy water and then rinse it really well and then dry it is also sufficient. When it comes to artificial materials, you may need to look up to see exactly what you can do, whether that's a dry heat, sometimes in the oven for a brief period of time on a relatively low heat setting. You have to be careful with microwaves because sometimes artificial masks have tiny staples in them, and that metal can cause sparking, or rubber and elastic can melt. So it's a little bit trickier how to sanitize artificial type surgical or hospital masks, and that may be something that you just need to turn to the manufacturer for.
All right, Dr. Aronoff, we're going to take a quick commercial break. We're going to come right back with more of your questions from Teresa, David, and Joe. Stay with us.